Okay, now let's talk about the advantages of placing implants in the centrals, and then we'll talk about the advantages of placing them in the canines. The advantages of placing them in the centrals is number one. You have better bone engagement in the centrals. Why? Because the teeth are smaller, which means that you have more bone to engage. Does that make sense? Yes? Okay. Number two, you have less anterior cantilever. What do I mean by this? Right now, the very beginning of the restoration is supported by implants, and the very end is supported by implants, correct? On the other hand, if you're placing your implants in the canines, you have anterior cantilever. Is that correct or not? Right? So if your patient has big arch curvature, it means that you have a lot of anterior cantilever. Make sense? Okay. What about the disadvantages? Disadvantage number one is that you have two long bridges, which are 6 units. So imagine this: if you have one tooth break, you're going to have to restore 6 teeth to replace 6 teeth, correct? So that's also very important. And also, if you're using a conical connection implant, a bridge like this, which is a very long bridge on conical connection implants, is very freaking difficult to place in fixing position and to seat it accurately and to take it out. So that's also one of the considerations you need to have in mind. So in terms of the disadvantages, as we said, two long bridges. If one of them breaks, it means that you have to restore 6 units, not only 3 as the smaller bridges. So it's a more expensive repair, obviously. And also it's more prone to fracture because it's a longer bridge, right? And also, if you're not passive enough when you're placing it or when you're removing it, you actually might break it, especially if it's a FP1, as we said. And then difficulty in seating, especially with conical connection implants, and I think all of us already know that. Single implant to place is easy, right? But for a long case or for a big case, it's very difficult to manage. Okay, and last but not least is possible midline misfits. So imagine if you're doing this. If you're placing two long bridges like these, isn't it possible for you to not seat one of them perfectly accurately? Yes. And what happens then? You have a slight mismatch in this area. So one bridge is going to be longer than the other, which is never a good thing, okay? Especially anything that has to do with the anterior needs to be very nice and accurate.